The coronavirus pandemic has been described by some as the great equalizer, but we all know that that is not the case. Actually, in describing the colliding problems of racism and coronavirus, scholar Ibram Kendi talks of the racial pandemic within the viral pandemic. I'm honored today to welcome three leaders from the field for a conversation on the racial pandemic within the viral pandemic. I want to welcome Dr. Lisa Cooper, Bloomberg Distinguished Professor at the Johns Hopkins University, Dr. Monica Burrell, Commissioner of the Massachusetts Department of Public Health, and Joni Holyfield, Baltimore native and founder of Heart Smiles. We're going to unpack this issue of coronavirus and racism, and I want to just begin by asking all of you, as we think about the differential burden of COVID amongst communities of color, many people think that the differential impact has been because of disparity and lack of access to care. We all know this is important, but it's also more complicated than that. Can each of you share how you see the role of race and racism playing out in this pandemic? Let me turn it to Dr. Cooper first.
Thank you. Thank you for having me today. So I think the first thing that I would say is that racism has existed for a long time in our society. And, on a societal level, we have a lot of negative attitudes and prejudices and stereotypes that have actually led to less support for policies that will provide equitable opportunities to people of color, and particularly African Americans, for centuries. And so when you have that and you have people who don't have equitable access to resources that are delivered by institutions, whether it's through employment or housing or education or healthcare, you see that has actually shaped health for a very long time. And so, when you think about that, we know that has led to things like, people having exposure to environmental harms and less healthy food environments. And so we see that people in neighborhoods of color have higher rates of obesity, diabetes, heart disease, so many chronic conditions. And so these are just the conditions that have led to health disparities and have been magnified during COVID-19.
Thank you, Dr. Cooper. Dr. Burrell, what are you seeing from your perspective as Commissioner of the Health Department in Massachusetts?
Thank you so much. I'm so excited to be part of this really dynamic panel. And I want to echo some of the things that Dr. Cooper said and add to that a little bit. I really appreciate her comments. When we think about a crisis, the crisis shows the gaps in our systems, right? And it kind of highlights things that have been there for a long time. And what I want to really focus on for a minute is what our role can be at the state level. We have been working at the Massachusetts Department of Public Health for several years now, looking to see where our populations are at highest risk. And what we found using a precision public health model, where we really are saying, what does the data show us? And who are the populations who need our services the most? Unfortunately, we see, which many of us in the field have known for a while, that there's a disproportionate need and disproportionate inequities in our communities of color. So as we've been working over the last few years at the Department of Public Health, we have said our focus area will be not on individual diseases like diabetes or heart disease or access to food even, but looking at populations who are most at risk and making sure we get our services to them. Now, fast forward to COVID-19, and what we noticed in April was that we wanted to be able, one of our duties as the health department is to make sure that we analyze the data that we have and share it with individuals so that positive change can be made. And what we saw is that race and ethnicity data was not being collected for COVID-19 individuals. And so what we did was we put an emergency order, a public health emergency order in place. I put that in place so that we could have increased reporting. And what that did is it brought, before we had death reporting by race and ethnicity by 28%, that went up to 98%. We had hospitalization reporting at 45%, that went up to 88%. And why do I focus on this? Because without being able to delineate where those inequities are, it's very hard to address them.
Yeah, thank you for reflecting and sharing those examples of what's happening in your state and what a state can do and what a health department can do in terms of leadership in this issue. I want to turn to Joni to hear a bit about how you're thinking about racism and race and the intersection with the coronavirus.
Yeah, absolutely. And let me first say, Keisha, I am so excited and honored to be sharing the stage with these two doctors. This conversation is so important. And Keisha, to be honest with you, I feel that race is playing the lead role in reminding poor people of color of the large gaps that exist between the haves and the have-nots. Most people living in poor communities of color, like the one that I was raised in West Baltimore, are numb to the inequalities or just don't even understand what they are because we're so busy living every day just trying to survive that that's so much more important than fighting a battle that your enemy doesn't even acknowledge. All the pandemic did was say to Mr. Race, you got broccoli in your teeth. Corona exposed the disparities on a global stage and forced everyone who was turning a blind eye to racism to pay attention to how deep this thing is and, at the very least, step out of denial. Poor people of color are still more afraid of the police than we ever will be of Corona or her devastating impact. COVID 19 didn't create these issues for us, she compounded the ones that we already had.
The image that you just described for everyone, and just the reminder that people of color, people of communities of color, people who come from poor communities of color, they know these issues, right? These issues have been at the forefront. One of the things I wanted to ask you, what are you hearing people talking in the community about, Joni, around the vaccine? We're talking about getting to a point where people are going to be protected. But we know that certain communities of color have vaccine hesitancy.
And thank you so much for lifting this one up. People are afraid, and rightfully so. When you've been burned so many times, it's hard to go back to that same flame to where as though you felt burnt you in the past. But what I would want for people in the community to understand is that COVID, the vaccine, that isn't the racist enemy. That isn't the racist problem. It's the laws and the policies that are founded in those racist issues and people who are operating in power with a racist heart. That's the enemy. The vaccine, once it's proven safe, it's definitely going to help save lives. But folks in the community want to know who they is. You know how people say, well, they say it's safe, or they say that this is good for us. This has to be a moment where we can't hide behind the they. And credible, trusted messengers in the community have to confidently say, you know what? I'm connected to they, and they is Dr. whoever such and such at whatever university, and be able to confidently say that they are working with us and we're all in this together. And this is something safe, and this is something that it doesn't matter where you come from, your social status, or your race. This is something that we're basically all in it together, and we all want to come out of it better.
I really appreciate you lifting up emphasizing who they is, who's the messenger, who's the trusted messenger of this information. I mean, Dr. Cooper, when you hear that, what's coming to mind for you?
What I try to live by is that I don't go and just start talking at people. I want to listen. I want to hear, like, what are their fears? What have they heard and what are they afraid of? And I want to show them that that I empathize. They have a reason to feel the way they feel. And then you work with as Joni mentioned, people who are trusted in the community, whether it be physicians of color, people who have worked in the community for a long time, and tell people what we don't know as well as what we know. So don't overpromise, don't act like we know everything, and then tell them really truthfully what we know about the process of vaccines and how they're tested and what safety precautions are put in, and whether or not we would recommend the vaccine to our family members or friends, or whether we ourselves would be willing to stand up and say, I would take the vaccine. I think that has a lot of credibility for people.
Yes, definitely. Being able to say, I'm going to be in line there, not telling you to do it without doing it yourself, right? Dr. Braun, how are you thinking about this as a commissioner from a state health department?
Yeah, I think the first thing is that we really all need to focus on vaccination against mistrust. There's a lot of information that's confusing for people. There's access to a lot of different pieces of information, and some of it is not accurate. So what we're doing at our state health department in Massachusetts is we have a three-prong approach, and that's about engagement, equity, and transparency. And it really echoes in some of the comments that were made before.
Yeah, thank you all for emphasizing the trust emphasizing listening, emphasizing relationships, and being in the community. There's so much to unpack here, and we're short on time, and I wanted to just ask for some wisdom from each of you. You know, we will soon be in sort of the recovery phase of the pandemic, where we are thinking about, I hate to say getting our lives back to normal, because I feel like normal wasn't working in the first place. But if we think about getting to a place where we are no longer under stay-at-home orders or wearing masks all the time, how do we prioritize an anti-racism approach to the pandemic recovery? So I'd love to hear each of you comments on that. Let me start with Dr. Cooper.
We talk a lot about herd immunity with these vaccines and the fact that, once everyone gets vaccinated, we'll be protected. Well, as Dr. Burrell mentioned and Joni mentioned, there's no point in having a vaccine if people don't get vaccinated, right? The fact is that we're not going to be protected from other kinds of pandemics like this until we have what I call a different kind of herd immunity, and that's being protected against all the negative social factors and protected against racism. So how do we do that? I mean, at the local level, we have local policymakers who can determine things like, what is the minimum wage for my state? Pay people a minimum wage that is livable so that they can afford to live in a healthy neighborhood, and that they can afford to buy food that's like nutritional. Things like providing early childhood education. So those are things that will benefit people who are most vulnerable even more than the rest of the population. Finally, I would say really raising kind of public awareness of the issue of inequities and why everyone should care about it. People don't realize that what goes on with somebody across town from me could be bad for me too and my children. So think about how the fact that we're not caring for people that are most vulnerable in our society is not good for any of us. It's costing everyone. And at this point in time with the COVID pandemic, you can see it's caused our economy to shut down. It's caused our kids not to be able to go to school. So inequities are bad for everyone. And if we can get everyone to sort of see that connection and also see that it's not about only people making individual choices, it's about the opportunities that people have to make choices. So this is not a problem that only belongs to one person or one group of people. It belongs to all of us because we created this by the decisions we've made.
Thank you, Dr. Cooper. And Joni, what about you?
Yeah, so Keisha, I'm not even going to lie. It's so hard to focus on just a pandemic recovery when COVID is like the predator in the ocean, but you've already drowned. Poor communities of color, we were already struggling to survive when COVID hit, and the pandemic really just put a roadblock on top of a roadblock. If we're talking recovery, I think any serious recovery will have to restart with the knowledge and acceptance that these problems were already bursting at the seams before COVID showed up. And we're sick of Band-Aids. Let's really treat the illness and not just the symptoms, along with making the vaccine safe and accessible. Help us to build the type of communities that you want to live in. Help us to provide the type of education that you would want for your own child. Too many minority lives are being cut short by people who don't know, don't understand, or don't care about anything outside of their own agenda. And people are sick of it. The pandemic recovery really has to include a plan to permanently recover from structured racism, structured poverty, if we really want sustainable change.
Thank you for that, Joni. Thank you. And Dr. Burrell, do you have any thoughts on this question?
As the people who are attending the summit, I ask you, wherever you sit, whether you're in a leadership position or you're a member of an organization or a member of a community, to take time to think about what can I do and how can I contribute and how can my institution or organization or group, community group, contribute to this and make lasting change accessible.
Yeah, thank you, Dr. Burrell. And that call to action, I think, is a great way to end this conversation. And I want to lift up what each of you said, which is around the importance of addressing those structural and institutional factors, structural and institutional racism. We have to address it. And Joni, I think you so eloquently talked about this predator in the ocean when you've already drowned, right? These are COVID-19 has exacerbated all of the things that were already wrong in our society around racism, and it's just exacerbated these issues. And so I really want to lift up that call to action. ask each of you what you can do around this issue to address the structural inequities, to address structural and institutional racism. And I want to thank Dr. Cooper, Dr. Burrell, and Joni Holyfield for being part of this conversation today to unpack this important issue of COVID-19 and racism. Thank you all for being with us, and thank you for listening to this conversation.